Every parent-to-be looks forward to the birth experience. For those parents who have a cesarean birth, special questions and concerns may arise. The goal of this program is to answer them. How does a cesarean birth differ from a vaginal birth? During a vaginal delivery, the baby moves down the birth canal and out through the vagina. In contrast, a cesarean birth is a surgical procedure. Either a vertical incision or a horizontal incision, which is most common, is made in the abdomen to reach the uterus. The amniotic sac, or bag of waters, is then opened and the baby is eased out. Some cesarean births are planned in advance, while in other cases, the decision to perform one is made after labor has begun. In either case, there are several reasons why your doctor may determine that cesarean is the safest method of delivery for you and your baby. Your doctor may decide that your pelvis, a bony ring through which the baby passes, is too small, or that the baby is too big to allow safe passage. This is called cephalopelvic disproportion, or CPD. A cesarean may be needed if the placenta, umbilical cord, or baby is in a position that would make it dangerous or impossible for the baby to be delivered vaginally. For example, the placenta could block the birth canal, which is called placenta previa. Or the placenta could begin to separate from the uterus, called abruptio placentae. The umbilical cord could fall below the baby, or prolapse. The baby could be in a feet and bottom first, or breech position. Or the baby could be in a sideways or transverse position. A cesarean might also be chosen if the mother has medical complications, such as diabetes or high blood pressure, or if problems occur during labor. Although complications from cesarean birth are rare, all surgery involves some risks. These include infection, bleeding, complications from the anesthesia, and injury to nearby organs, such as the bladder or bowel.
I have a lot of confidence in my doctor, and we talked it over early on in the pregnancy. And the night before, I got a good night's sleep and came in fresh that next morning. And the whole procedure, it just seemed like a matter of moments before I had a beautiful little girl.
Whether a cesarean is planned or unplanned, you will undergo certain preparations beforehand. An IV is started to provide medicine and fluids during surgery. A urinary catheter may also be inserted to drain your bladder. In rare cases, general anesthesia is used, in which you are completely asleep. In most cases, regional anesthesia is used, which means only the lower part of the body is numbed, and you remain awake and alert. Regional anesthesia may be either epidural or spinal. For either type of regional anesthesia, your back will be cleansed with an antiseptic solution and a local anesthetic will be injected. With epidural anesthesia, a needle is placed into the epidural space, which is just outside the sac that contains spinal fluid. A thin flexible tube called a catheter is threaded through the needle. The needle is removed, and numbing medication is delivered through the catheter. With spinal anesthesia, a needle is passed into the spinal fluid, and numbing medication is delivered. The needle is then withdrawn. With either type of anesthesia, you will be comfortable during the operation. Usually, your labor partner may be present. In some cases, you can watch the operation in a mirror if you choose to. Once your abdomen has been cleaned and draped, an incision is made in the abdominal wall.
I was awake the whole time. I could share conversation with my husband, and I kept asking him, how am I doing? How's the baby doing?
The incision is continued until the abdominal cavity is reached. Then the uterus is opened and amniotic fluid is released. The baby is then delivered.
Little baby girl.
You may feel some pressure or tugging at this time.
If you took your finger and pressed hard against your arm, that's about the type of pressure that you feel.
Delivery usually occurs in the first 10 minutes of the operation. After the cord is clamped and cut, the baby is given a physical examination.
Take a look at her.
She just was beautiful. I could see the little brown head, and it was real round and pretty, and little button nose. And just to be able to reach over and touch her just right away, it was important to me to just be able to feel her skin and feel how warm she was.
Can you see her?
Hi, sweetheart. Pop your thing. Oh, can somebody take my mask off?
Yeah, you want it off?
Just for a minute. Hi, baby. Hi, sweetheart. Oh, mommy loves you.
Jill was 3 weeks more baked, though.
I love her so much already.
Come on here.
No, I don't want that.
She's pretty.
I actually got to watch her skin dry. I got to watch her cheekbones almost lift into place and her face round out. She just became a person in front of me.
I forget how tiny they are. Look at that little nose. Oh, you happy now? Mommy is.
After the placenta or afterbirth is removed, the incision is closed with stitches that are absorbed by the body or with stitches or steel clips that are removed later. Finally, a sterile dressing is placed over the incision. The entire operation usually takes about an hour. After surgery, you will be moved to the recovery area, where you'll be observed by the staff before moving to your own room. In some cases, you can be with your baby during this time.
Baby girl.
That was the best, when they brought her to me in recovery. And she was actually placed in my arms. And to be able to hold your own baby for quite a long time and just stroke her and tell her, this is mommy, and I'm here and everything's fine. I just loved it, to be able that soon after delivery to hold your baby and to not feel any discomfort. So it was a wonderful experience.
After a cesarean, it's common to have pain around the incision site for several days. Pain medication will be provided as needed. In some cases, you may be able to control the amount of pain medication you receive by using a special device.
They brought the baby to my room within an hour of returning from recovery, and I was able to nurse her right away, and she took to that very easily. And it was just a very close bonding experience from the very first day.
You can breastfeed your baby just as with a vaginal delivery. Pain medications are chosen so that only a minimal amount of medication reaches the baby. You'll be encouraged to walk soon after your operation to improve circulation. The urinary catheter will probably be removed within 24 hours. You'll be given liquids and later solid foods, according to your doctor's instructions. Within 3 to 5 days, you should be ready to go home.
Thank you. I had help when I came home, and that's a good idea. And the baby is the #1 focus in your life, so you're elated anyway. And I think the whole healing process goes so much more quickly than with any other type of surgery. Your mind isn't focused on yourself or what you're going through.
During the first few weeks of recovery, it's normal to have some vaginal bleeding and mild pain. However, call your doctor if these symptoms increase. If you experience fever, significant redness around the incision, painful urination, or if you develop engorged breast with redness or fever. As after any type of surgery, your recovery will take time. Take it slowly. Some women experience disappointment over not having a vaginal birth. This is not uncommon. However, if you feel depressed or unable to cope, talk with your doctor. In about 4 to 6 weeks, you'll have a checkup with your doctor. At that time, you should be ready to resume normal activities. Depending on the reason for your cesarean and the type of incision in your uterus, you may be able to have future babies vaginally. Many women are now choosing this option, called vaginal birth after cesarean, or VBAC.
I think the most important thing to know going into a cesarean is to relax and enjoy it. Relax and enjoy the experience, the birth of your child, and focus on that, and it'll just turn out to be a wonderful experience. I had no letdown at all that I wasn't able to deliver vaginally, to be able to hold your baby in your arms, and for the rest of your life she's yours, and it's well worth anything that you have to go through.